Good morning, ma'am. I'm Isa Luis Alvarez from BSN1 M4A, and today I will be demonstrating the proper transfer of a patient from the bed to a stretcher and from a bed to a chair. My objective is to ensure the patient's safety and dignity while promoting mobility and applying proper body mechanics to prevent injury to both the patient and the caregiver. So first, I will review the patient's chart and nursing care plan. Then I will assess for the patient limitation of movement, IV tubing, and incisions that may affect the transfer of the patient. Then I will perform a hand hygiene and wear proper PPE if indicated. Now we will be identifying the patient. So, good morning, ma'am. I'm Isa, your student nurse from Our Lady of Fatima University. May you please verify your name and your date of birth?
My name is Isabel Maureen Alvarez, and my birthday is February 10th, 2009.
Okay, so today, ma'am, I will be transferring you from your bed to a stretcher, and this procedure may require assistance of nurses. So, now I will close the door or the curtain for privacy. Then, I will lower the head of the bed as the patient tolerated. I will match the height of the bed to the stretcher. Then, I will lower the side rails of the bed. Now, we will be placing a bath blanket over the patient. Please hold this now. And remove the top sheet. The blanket provides warmth, comfort, and privacy for the patient. Now, I will be placing a reduced friction sheet midsection of the patient. Now we will tap the patient's arm across the chest and tap the patient's neck towards the chest. Now we will gently move the patient towards the nearest place. Now we will move the patient to the near side of the bed to the stretcher. So ma'am, I will be pulling you, ha? So, on the count of 3, 1, 2, 3. Okay. So the patient is near on the side of the stretcher. Now, we will be placing this stretcher parallel to the bed and lock the wheels. So assuming this part of the bed is the stretcher, and now we will lock both the wheels of the stretcher and the bed to prevent unwanted movement and safe transfer of the patient. So when you hear a click from the bed and the stretcher, that is a sign that the wheels are locked. Now, assume that I have assisting nurses. Assume that 2 nurses are standing on the stretcher side and 1 nurse is on the opposite side of the bed. Now, we will be placing a transfer board on the patient. Assume that this is a transfer board. So we will place the transfer board partially underneath the patient. So first we will gently roll away the patient. Then we will place the transfer board underneath partially of the patient. Then roll back the patient to the transfer board. There. Now, one of the assisting nurse will grasp the reduction sheet at the designated area to provide balance support. Now, we will be moving the patient to the stretcher. On the count of 1, 2, 3, I will be transferring the patient to the stretcher. 1, 2, 3. Okay, so now the patient is now safely in the stretcher. I will remove the transfer board. give the patient the blanket. And remove the fat blanket that was given earlier and please hold it now. Then I will raise the side rails. Then I will raise the side rails and clean the transfer equipment according to the facility policy. Then I will remove the PPE if worn. Then I will perform hand hygiene, and that's the procedure of transferring from bed to stretcher. So first, I will review the patient chart for any limitation of movement and IV tubing lines and any restriction of movement that will affect the transfer. Then, I will gather all the necessary equipment and arrange them according to the order that they will be used. Next, I will perform hand hygiene and wear appropriate PPE if indicated. Now I will be identifying the patient and explaining the procedure. So good morning, ma'am. I'm Aisel, your student nurse for today for our Radio Fatima University. May you please ask for your name and your date of birth?
My name is Isabel Alvarez and my date of birth is February 10th.
Okay, ma'am. So for today, I will be assisting you from transferring the bed to chair. So after explaining the procedure to the patient, I will close the curtain or the door, and if needed, I will move the unnecessary equipment in the place. Then I will lower the bed and raise the head of the bed tolerated by the patient. There. Then I will place the chair near the bed. And lock all the brakes. Now, if available, I will encourage the patient to use the stand assisting device as this will help and promote them independence and prevent the risk of injury. Now, I will be standing near the hip of the patient, with feet and shoulder wide apart, and I will assist the patient to sit at the edge of the bed. So I will allow the patient to dangle the feet, and I will assess for any dizziness or balance problem. So ma'am, do you feel any dizziness right now? No. Okay. Now I will assist the patient to wear robe. Then a footwear. As the robe prevents warmth and comfort, and the footwear prevents risk of falling. Now I will secure the gait belt on the patient chest, hip, waist. So this gait belt provides secure grip and prevents risk of injury. So can you raise your arm? Raise your arm. Okay, so once the gait belt is secured, I will stand in front of the patient with my hips and knees flexed, and I will assist the patient to slide forward until the patient feel the feet on the floor. 1, 2, 3. Okay. So now that the patient feet on the floor, on the count of 3, I will assist the patient to stand. 1, 2, 3, stand. Okay. So then I will pivot with the patient until the patient feels the chair on the back of his legs. Then I will ask the patient to reach for the chair. Can you reach for the chair on your back? Reach for the chair. Yes. Okay. Then slowly lower. Then I will assess for alignment. Then I will remove the gait belt. And give the patient a blanket, and a call bell within the patient reach. So after that, I will clean and transfer the transfer equipment according to facility policy. I will remove my PPE if worn, then I will remove the PPE if worn, then I will perform hand hygiene. And that's how you transfer the patient from bed to chair.